Hello, welcome back. Today's topic is about cancer, an introduction to cancer. In this video, we will talk generally about an introduction to the cancer, and in other videos, we will talk about individual gastrointestinal cancers. What is cancer? Cancer is nothing but an uncontrolled, disorganized cell growth and a spreading of the cells. Right from the day the ovum is fertilized, each cell is multiplying or growing on a regular manner, in a synchronized in a pattern. When this pattern is changed in an uncontrolled manner, that's called cancer. Each cell has their own size, shape, function. When this is called a differentiation of the cell. So suppose there is a bone cell, then it has certain functions. If the gastrointestinal cell has certain function. When this differentiation is lost, that is where the cancer is forming. So what are the causes for cancer? The first and foremost, everybody knows is genetics or familial. So in our body we have oncogenes. Onco means cancer, genes means genes. These oncogenes, when their number is very high, or tumor suppressor gene, these cells which prevent the cancer growth, when their level is very low, then cancer can happen. This happens in the gene level, DNA level. When there is a mutation or there is a deletion, addition, then the cell can change into a cancer. And this to happen, there should be some injury or a reason for this to happen. So what are those things? Like first is, we always say environmental. So environmental factors, first and foremost, we always say. Suppose, for the best example, we always say, in Australia they are exposed to sunlight because of their location itself. The sunlight comes and directly hits, so they are more prone for skin cancers. And in certain places the soil is more of radioactive material, so they can get certain cancers. In certain places, pollution, the air pollution because of industries or because of the vehicles, the upper aerodigestive cancers are very more. So these are environmental factors. Not only this, there are certain viruses that can cause, that they are called oncoviruses. They are all can cause cancer. There are DNA, RNA viruses which can cause certain cancers like leukemia, lymphoma. The best example is Epstein-Barr virus, which can cause Burkitt's lymphoma. In human papillomavirus can cause uterine cervix cancer. So these are all oncoviruses which can cause cancers. And apart from these things comes the environmental to the lifestyle thing. The lifestyle, the diet is the first and foremost. So if somebody has a diet rich in fat, they are prone for certain cancers like breast cancer, colon cancer. And that is why we always say, cut down your fats in the diet. And if the preparation of the meal, if a deep fry or repeatedly using the same oil to fry, the oil from the unsaturated fatty to becomes a saturated fatty acid. So this can cause certain cancers like colon cancer, liver cancer. All these things can happen. Then preservatives. Most of the preservatives are either they have rich in salt as well as nitrates. The best example is pickles. They have a lot of salt. And any packeted food, they'll have a lot of salt and nitrates. So these can cause cancers. So that is why we always say, don't take junk foods or packeted foods. That can, in the over a period of time, can cause cancer. There is the same reason why even we say don't take food outside, especially in the restaurants. What? Because we don't know how much times they are using the oil for frying, or even certain foods like barbecue, directly they put the meat into the fire. These are the main reasons for diet part of the cancer. And next comes is the smoking and alcohol. And everybody knows about the smoking and everybody about the alcohol. Tobacco in any form, either smoking or chewing, can cause upper aerodigestive cancers. And alcohol again cause colon cancer, liver cancer. All these things can happen with the liver. And the combination of these two, smoking and alcohol, is a deadly combination. The chance of cancer increases by 60%, especially with genetic factors also included. So the other reasons, age. As we get older, after 40 years, there is every likely chance of cancer. This is an unmodifiable factor. We can't stop the age. So this is unmodifiable, but all other things are all modifiable. And another main important in the lifestyle is, even the previous videos we have told about the obesity. Obesity is the foremost lifestyle reason for cancer, especially if a child is obese, and if they obese for the 40 years, then they have a chance of getting colon cancer, breast cancer, because the fat always has all the hormones, especially women, with the estrogen is more, and they get, because of that, cancers. So obesity and sedentary lifestyle, lifestyle without any exercise, there's another reason for cancer. So these are the environmental and lifestyle plus genetic factors. And okay, once these are the causes for the cancer, means what are the symptoms? What are the general symptoms? So usually we say loss of appetite, completely no loss of appetite, or sudden weight loss, unexplained weight loss, or bleeding from the natural orifices, from the nose, mouth, anal region, or even through the urine, these things. And is there any swelling, palpable swelling or visible swelling? Especially if the swelling is painful, you can feel a little safe. But there is a painless swelling and it suddenly becomes painful, then you have to be a little careful. And even if you have a neve or mole, suppose you have a mole and suddenly it becomes bigger, or itching or bleeding, or become more darker, then chances of cancer is very high. So some bowel and urine changes in, altered bowel, we call that. Suppose somebody has a constipation for some time, then suddenly they will lose motion. Again, constipation is an altered bowel. Or even urine, there is a bleeding in the urine, or some difficulty in urination. All these things could be, need not be, yes, no, it could be a reason. So we have to look deeper and we have to see the doctor and confirm nothing is wrong. So these are the things. And hoarseness of voice changes, or non-healing soreness, or non-healing ulcer, wound, anything. These are the symptoms that can, we should little take care to go see the doctor and rule out cancer. So these are the things as we should always, teach our children also, and especially anemia. Most of the cancers, especially gastrointestinal cancers, they present most of the time only with anemia. So we should always educate, not only the regular education. Apart from that, we should teach our children about to take care of themselves. Like, they should examine them every day, like looking for any swelling, anything, or unnatural from the natural orifice, any unnatural bleeding, or weight loss, loss of appetite, anemia, change in voice, hoarseness of voice, non-healing, ulcer, wound. These things we should teach our children. Okay, once these are the symptoms, okay, what next? How to diagnose? The diagnosis, so first and foremost, is from the clinician. The doctor examines, he'll ask certain questions about your work, place, with that you can come to a conclusion whether you may or may not have this cancer. So you'll ask for some tests like X-rays, ultrasound, blood test, CT scan. These things can pinpoint whether to diagnose the cancer. Okay, once the cancer is diagnosed, then what next? So next, the clinician will classify and stage the disease. So the classification, usually we call that generally TNM classification, TNM. T for tumor size, and N for nodes, nodal metastasis, lymph nodes. That is from one region from the cancer to the nearest node. That's called nodal metastasis. Then metastasis, distant metastasis. Usually distant metastasis can happen in the lung, bone marrow, liver, brain. So this is how the cancer are generally classified. And apart from that, staging. According to the classification, the stage of the cancer is decided from stage 0 to 1, 2, 3, 4. It's divided into 5. Stage 0 is almost good, very good prognosis, and stage 4 is prognosis very poor. So these are the general classifications and staging. Not only staging, most of the people confuse with stage and grade. Grade is severe, they're well differentiated, undifferentiated, or poorly differentiated, they say, or aggressive. So these are grade. Grade is different, stage is different, and classification is different. Okay, once these things has come, then comes the treatment part. So treatment wise, any visible or anything you can see, either from physically or through the radiologically, the first and foremost is surgery. And if certain cancers, most of the cancers will have a surgery followed by chemotherapy, and certain cancers will have a surgery, chemotherapy, radiotherapy, or surgery and radiotherapy. That depends upon the biopsy, the grade, the cell type, that will be decided by the cancer specialist. And usually the prognosis is good for stage 0, 1, and is very poor in stage 4. So the prognosis can be easily improved. The most of the studies, there are a lot of studies, they say aerobic exercise is one of the main thing that can improve the prognosis of any cancer, or even somebody has a genetic factor for a cancer, and if they do control their weight, and they do exercise, and they change their lifestyle and the environmental factors, the genetic reasons for cancer is almost comes to very minimum. So if somebody has most of the people ask us, okay, my father has a cancer, will I get that cancer? Or my mother has a cancer, will I get? For those people, scientifically what we say is, first and foremost we say is, don't get married within the relation. Consanguineous marriage. So avoid consanguineous marriage, or even I always say, don't even get married within your place. Get married in a distant place, even other country. So keep it as far as possible, first one. Second, the environmental and lifestyle changes, quit smoking, alcohol, keep your weight to the normal one, and very importantly, all the studies say doing aerobic exercise, keeping yourself fit by exercise, can prevent the genetic reasons of cancer to the minimum. So cancer is a preventable disease. So when we know when to seek for help to the doctor, you can go and ask for this, whether, and if they do everything and they rule out is not cancer, that's the best thing. So prevention is the best thing in cancer. Even if it happens, nothing to worry. There are treatments available with the modern science. There are good treatment available for almost all the cancers. So we teach our children, apart from the regular schooling, right from the day now itself, we teach our children to look for weight loss, anemia, loss of appetite, bleeding from anywhere in the body, and severe kind of fatigue, and any swelling in the body. All these things we should educate our children, and we can prevent the cancer. Thank you.